the Dragons Awards 2020, and we're waiting for Sebastiaan to be connected. After that, we'll have a pop-up, and the pop-up will be the opportunity for you to vote, which I stimulated you to do forwards. And here is Sebastiaan Blok of Hartwatch or Hartwacht. Sebastiaan, welcome. Welcome to the floor. The floor is completely yours. Go ahead.
Thank you very much. I was asked also to present, so if I can share. I think I'll do everybody a favor by shortening my presentation a little bit, so I'll be quick.
Thank you so much, because we're indeed a little bit over time, but it's due to some fact that all the nominees have put their pitches. Here you go, from Amsterdam.
From Amsterdam, yeah. My name is Sebastiaan. I'm involved with Cardiology Centers of the Netherlands, Heart for Health, which is a software development company, and Amsterdam UMC, for which I'm doing a PhD research. The Cardiology Centers is an organization of outpatient clinics spread throughout the Netherlands. And in 2016, we were rewarded with the Value-Based Healthcare Collaboration Prize. And we were awarded the prize because of our initiative called Hartwacht, which is the following concept. We have a patient at home, which has devices. With the devices, the patient can do measurements. The measurements are sent through an algorithm and will be interpreted by a Hartwacht team of nurses supervised by a medical specialist. The patient has his online patient file with all the measurements and also with the rest of the medical file available. We have a lifestyle advice tailored to the patient, and if necessary, the patient can visit one of our outpatient clinics. The home measurements are also put in the medical file of the patient, which also contains the medical history, medication, and all those kind of things. So the home measurements are assessed in the whole patient history. And I put this little dotted line around this whole concept because we agreed with the insurance companies that we have a bundle payment scheme to get reimbursed for this whole infrastructure. So as previous speakers also noted, this gives us the incentive to keep most of the patients at home and healthy. We will not send an additional invoice to the insurance company if the patient will enter the outpatient clinic for the same diagnosis. So this whole team is in a subscription model reimbursed for us. We've been doing it for quite some time. Last year we received the Value-Based Healthcare Prize, which maybe sparked attention a little bit, and you see a kind of a bigger increase than before in active Hartwacht users. Here we have the COVID pandemic, of course, which also sparked the growth. So we recently touched our 2,000 active patients. These are only the active ones, and because most people stop after some point, the total amount of patients that we monitored is much higher. Ever since, we've been doing research, for example, onto the clinical effectiveness. I will go through it very quickly. As an example, we've been doing research on the decrease of healthcare usage before and after implementation of Hartwacht. We've been building cost effectiveness models to not only see how it is cost effective right now, but also in the future. We've been sending out prompt questionnaires, of course. So we're very narrowly monitoring the quality of life of our Hartwacht patients comparing to usual care. We are also seeing whether we can see from data who responds to the home monitoring program and who doesn't, to make the program more fit and set it to the right patients. And we're also doing qualitative research to ask the patients how they think about using these systems. And interestingly, the qualitative research is not always giving the same results as the quantitative research with the prompts, but we're trying to get it all together and keep on increasing and improving the program. Right, so that is what we got the Value-Based Healthcare Collaboration Award for last year. I think key here is that after receiving it, we kept on monitoring, we kept on researching, we kept on improving, and we kept on adapting the program in order to make it suited for the most of our patients. Yesterday we had the Dragon Dance event, in which we saw lots of new initiatives, which were very exciting. And we chose one to grant the Dragons Grant to. That initiative, let's see, that initiative that we selected with the jury is called Pima, and it was presented to us, I hope I'm correct here, by David and Dolores. They showed us Pima, which is a personalized care plan for people with sleep apnea. They were very impressive in making their initiative personalized but also scalable. They checked all the boxes of the value-based healthcare plan by researching cost, quality of life, and really focusing on adding value for the patients. So we were, as a jury, very much impressed, as we were with a lot of initiatives, but especially with this one. Normally, I think in real life, I would hand over the award here to this initiative. Now I would do it digitally, and I would at least congratulate you and want to encourage you to keep on improving, keep on researching as you're doing, and also focus in the future on your clinical evidence on what your initiative is actually doing for the patients on a clinical way.
Thank you so much, Sebastiaan, for this presentation and election of the award. Usually, normally we should have fireworks, confetti, drinks, and a lot of applause. It's a bit like the Oscars of last year. It's a bit more discreet, but nevertheless, the compliments for this Pima initiative is the same. We're going to the voting procedure for the collaboration awards, and there should be a pop-up coming up now. I'm going to ask the organization committee, is the pop-up coming now, or we have still? We're going to vote now. No, it's the presentation first. Right, sorry, I can see it now, and Pima is actually going to present their pitch of their project. Sorry to keep you waiting, but still you're here. Nice to have you here. Please, hello. The floor is yours. Go ahead.
Hello. Well, Pima,
congratulations to start with. Congratulations.
Thank you. Thank you. It was unexpected because we found really beautiful projects, but we are happy. And well, to talk about Pima, Pima is a personalized care plan to improve outcome in patients with obstructive sleep apnea with the CPAP treatment. The 4 pillars of Pima are stratification of patients based on personal features of each person, a specific educational training program based on a motivational interview, and an internal evaluation to know patients' behavior with the treatment using a psychometrically validated questionnaire with predictive capability, and a flexible care plans adapted to each patient's profile and situations. Pima, I think the strong thing of Pima is that the result of 3 randomized controlled trials that we did in 3 public hospitals in Spain. And the main results that we obtained with these trials were we improved the adherence of patients to this treatment in more than 2 hours per night compared to the standard rules, the control group. The patient improved significantly in clinical outcomes as somnolence of tiredness, and we improved the outcomes that matters to patients. They declared that they improve the quality of life, the mood, the social relationships, and the daily activities. We are currently implementing this Pima program in other European countries like Italy, Portugal, and we are adapting the outcomes that matter to patients for each country. And in the other hand, we are building now the medical economical model trial to transform these outcomes in efficiencies to the healthcare systems. And I feel proud because I think we are not talking about the device. This is the current, the treatment where the people used to talk about the sleep apnea, they talk about the device. And with this Pima, we are talking about the patient, and we are talking the nurses and the training program. I think it's important to empower the concept of Pima. I think it's this patient-centric.
Well, thank you so much for explaining your project of Pima. It's really nice to hear that you're aiming at the patients and not at the device, but that's a thing we all are fond of. Thank you again, Pima, and congratulations with your award. So it was a bit early a couple of minutes ago, but now it's going to be time to vote for the community awards. And first of all, we have the after movie video. Yes, here it comes.
A special welcome, of course, to the Dragon's Den. Those are the people that, of course, are important, that will determine who's going to get to the finals and who's gonna win. This year's endorsements winner is Promotion Quality. Congratulations to you. Yay! Dragon's Grand winner to be Pima. Congratulations, Pima.
Super happy.
Super happy, really.
Super excited listening to others' initiatives and to learn. And also really happy to see there are many things going around in many places from the industry, from the public sector, Valley-based is kind of getting more powerful everywhere. Really thanks to the Valley-based Healthcare Center for organizing and with this passion and coordinating everything. And so thanks a lot for that.
Well, this was obviously a great moment to share what happened yesterday, the award-winning. Again, Pima, congratulations, and thank you all for subjecting your projects.